Hi everyone and welcome back. Have you ever wondered if you're actually getting an accurate blood pressure reading? Using the correct technique is more important than most people realize. In this video, I'll cover everything you need to know about measuring BP using a digital monitor, covering the parts, setup, tips for accuracy, what your results mean, and a demonstration of the correct measurement technique. Stay with me, and by the end, you'll be checking BP like a pro. Let's start by getting familiar with the parts of a digital blood pressure monitor. First, we have the main unit. This screen here displays the systolic and diastolic readings along with pulse rate and battery level. Below, there's the start-stop button, and here is the air jack where the air plug connects. Flip it around and you'll find the battery compartment. This model runs on 4 AA batteries. Inside, it also has a built-in inflation pump to pressurize the cuff and a stabilizer sensor to measure pressure changes accurately. Now let's take a look at the cuff and tubing. The cuff is what wraps around your upper arm. Inside, it has an inflatable bladder in this area that fills with air to apply pressure on the brachial artery. The bladder is enclosed within the fabric of the cuff and is not visible externally. To identify the bladder, you'll have to feel for it. Gently press along the cuff like this, and you will feel a firm rectangular part. I've marked it here for easy identification. The cuff's outer layer is a strong fabric. There is Velcro near the free end to secure it. The other end has a metal D-ring to help wrap it snugly. Notice these markings on the cuff. The downward arrow and the artery marker help with correct placement. The side with the downward arrow and the tubing should face downward near the elbow, while the artery marker should line up with the brachial artery for accurate measurement. Lastly, there's air tubing, which connects the cuff to the main unit. Air flows through this tubing to inflate the cuff. This is air plug, and it is connected to the air jack like this for taking a reading. There are different cuff sizes available depending on arm circumference, and we'll cover more about choosing the right size later in the video. Alright, now that we are set up, let's get started with taking a measurement. Perform hand hygiene before and after the procedure. BP is typically measured on the left arm as it's closer to the heart. But if left side isn't accessible, you can take the reading on the right arm too. Ensure to take any subsequent or follow-up readings on the same side. Ask the patient to roll up the sleeve or remove any clothing that covers the upper arm. The arm must be bare where you have to place the cuff, as clothing or fabric can interfere with the reading. The patient should be sitting comfortably on a chair with the back supported. The feet should be lying flat on the floor, not crossed. The patient should be relaxed. There should be no talking or movement during the measurement. The patient's elbow should be supported on a table with the forearm and hand resting comfortably on the table and the palm facing upward. Ensure that the brachial artery or upper arm is at the heart level. In this position, the elbow is slightly flexed around 15 to 30 degrees and the arm is relaxed. There are 2 ways to wrap the cuff. If the cuff is completely open, place the cuff on the arm, wrap one end of the cuff around the arm and pass it through the metal D-ring at the opposite end. Now pull the cuff through the loop and snugly wrap it around the arm. Secure the cuff by pressing the Velcro firmly. Ensure that the lower edge of the cuff is about 2 to 3 centimeters or 1 inch above the elbow, or simply 2 fingers placed horizontally above the elbow crease. You can also pre-loop the cuff. Just insert the free end of the cuff through the metallic D-ring. Now hold the cuff so that the tubing aligns with the inner side or the medial side of the upper arm. Slide the patient's arm through the cuff as if putting on a sleeve, positioning the lower edge of the cuff about 2 to 3 centimeters above the elbow. Adjust the cuff so that it fits snugly around the arm. Secure the cuff by pressing the Velcro. Wrap the cuff snugly, but ensure it's not too tight. 2 fingers should comfortably slide between the cuff and the arm. Ensure that the tubing runs along the inner side or the medial side of the arm, lying straight and not twisted, and point it downward toward the monitor. The tubing should be free from kinks or bends. Now press the start button on the monitor. The patient should be relaxed and should stay still during the process. No movement and no talking. The cuff will automatically inflate, creating pressure around the arm and then slowly deflate. The monitor will detect the BP during the process. Once the measurement is complete, the screen will display the systolic and diastolic BP as well as the pulse rate. Note the BP readings, date and time of the measurement. Now power off the monitor and carefully remove the cuff by undoing the Velcro and sliding it off. After use, neatly roll or fold the cuff without kinking the tubing. It keeps the equipment in good condition. Now look at some essential do's and don'ts for accurate readings. Sit calmly for at least 5 minutes before measuring blood pressure. The bladder should be empty. A full bladder can raise readings. Use the right-sized cuff. Measure the arm circumference around the midpoint of the upper arm between the shoulder or acromion and elbow or olecranon by wrapping around a measuring tape. Now compare the bladder dimensions of the cuff with the measured arm circumference. The bladder width should be at least 40 to 50% and its length should be at least 80 to 100% of the arm circumference. Alternatively, ensure that the cuff width is approximately 66 to 75% of the acromion to olecranon distance, that is the upper arm length. You can refer to this table to help you match the arm circumference with the appropriate cuff size. The patient should be positioned correctly as explained earlier. To ensure accuracy in blood pressure measurement, take at least 2 readings 1 to 2 minutes apart. If the readings differ significantly, take a third and average the closest two. Now coming to the don'ts. Do not exercise, consume caffeine, or smoke at least 30 minutes before taking a measurement. Stay still and silent during the measurement to avoid spikes in readings. Don't overlook maintenance. Ensure your sphygmomanometer is in good working condition to avoid inaccurate readings. Now let's take a quick look at the classification of blood pressure according to various international and Indian guidelines. To keep this video concise, I won't go into the details, but you can pause the video here to review the table in depth. Remember, a small effort in precision goes a long way in protecting your health or your patient's health. Stay informed and stay healthy.